Well, good afternoon, everybody. My name is John Marshall, and I am one of the co-chairs of Safe Together, Strong Together here at Colorado Mesa University, here with my partner in crime and co-chair, Dr. Amy Bronson. Thank you again for being here, Amy.
Absolutely.
We will spend the next few minutes here trying to go through some additional information. We know we've been trying to be very communicative as time has gone on here and as the moment draws near that we all come back to campus safely. There's been a lot of activity over the last week, and we want to bring you up to speed on as much of that as possible. We've also got a special guest today that we'll introduce here shortly. So that said, I'd like to jump into a couple of web updates that we would like to make and show you. So before we begin today, there have been some concerns offered by a number of folks during the last session regarding the symptom checking using our web-based tool called Scout. I think perhaps some of the confusion was caused by me and frankly talking about this as an app in the past. And as it turns out, it's really just a web tool. It's a mobile optimized web tool, which is the appropriate term for that. So CMU and the health agencies are requiring that we use some version of these safety protocols, and Scout is really one of the ways that we're going to get that accomplished. So over the last few weeks, we've been discussing this idea that students have choices about what's right for their life, and I want to be clear with everybody that choosing to opt out of CMU's safety protocols that are protecting everybody physically on campus means that perhaps CMU is not the place for you at this time on campus. So that may mean that you want to take your classes online. You may choose to make other plans. I think where we're trying to be really, really clear is that if you're going to be on this campus physically, if you're going to be a part of this university this fall, we simply, all of us, whether you're on the grounds crew or a student or the president or a professor, we've all got to make ethical choices and we've all got to commit to one another to be safe. And so there's a variety of protocols that means we're going to be taking, and protecting our campus is really the key to this privilege of being here and staying open. So as we've done in the past several weeks, we're going to continue today's information session by highlighting some new content and web resources that have been added to the Safe Together, Strong Together website since our last discussion. Information regarding CMU's response to the COVID-19 pandemic and our return to campus can be accessed in our top navigation from anywhere on the CMU website. This week, CMU student body president Bo Flores and student trustee Amara Hobbs shared with students some tips and tricks on new safety protocols. Their video goes to show that while COVID is a very serious public health emergency, our students are still finding a way to have fun. If you haven't met Bo and Amara, you will appreciate that video. The weekly blog. So President Foster shared his thoughts on our weekly progress, including his presentations to alumni, news on athletics, and more, where you can see some of that. And throughout the course of the pandemic, of course, many of you have tuned in as President Foster has hosted numerous town hall meetings with CMU parents to answer questions and provide updates. This format occurs in the evenings and is a great way for people to maybe who aren't able to tune in during the day to get information and ask questions. And if you're able to listen in to his last town hall, you can click on the recordings, and the audio broadcast is linked here on the website. Something we've been working on for some time is our data dashboard. This tool was launched last week and includes the latest information about campus testing and positivity rates, as well as confirmed cases. We'll be updating that again tomorrow evening after this week's testing. Travel guidance. So we also added in some additional travel guidance. I think a number of you have asked this question specific to Mesa County, which is where our original guidance was. In consultation with public health officials, we have expanded that to include Mesa, Delta, Montrose, and Garfield counties, as these counties really represent kind of a homogeneous region for us here locally. So that is the travel region that we've identified, and we want to make sure that you're aware of that. As always, we show you our frequently asked questions page because it changes daily. Every time we get a good question or suggestion, we provide question and answer on this page so that everyone in the CMU community can track information on our responses to the pandemic day to day. So, Dr. Bronson, here we are back again, but we have a new guest to try and break up the Dr. Amy Bronson show here a little bit today, right?
Well, I think it's the exciting piece. We've been talking a lot about our Medical and Health Advisory Board and the experts that we have here in our community and here on campus, and we have one of them here today. So we'd like to welcome Dr. Lucy Graham. She's the Director of Nursing Education Programs here at CMU and Assistant Professor here of Nursing, and just really thankful that you're here today.
Thank you.
Not only do you lead the charge for our nursing programs, but you also have been running command over what's been happening at our testing sampling site. So really appreciate your efforts over the last couple of weeks and all that you've done to make that happen.
Thanks.
I think there's a lot of folks out there that maybe we just dial it back to the basics and find out, why are students being tested before they come back to campus?
That's a great question, and one we get often as people drive up to get their tests, in fact. So having a sense of your COVID status at the beginning of the semester gives us an idea of our disease prevalence, so how much COVID is already in our community of students and staff and professors, but it also helps us provide some early intervention, so as students or staff or professors are identified, they can quarantine and then come back to their role here on campus safely. So it's one of prevention. If you get your test done and you know you're negative, then you can continue to follow through with all the things that we know keep you healthy and safe from COVID. If you happen to have a positive COVID test, and even if you're asymptomatic, you can self-isolate, you can quarantine, and you can reduce that transmission of the virus, which is the ultimate goal of that.
Absolutely. Yeah, and I think one of the interesting pieces, we're seeing a lot of folks saying, but I've already been tested. Why do I need to test again?
Right. So when we're testing, we're doing an antigen test, and that tells us in this moment, do you have COVID? So if you had a test in June, in that moment in June, you may not have had COVID. So when you test again in August, perhaps you've traveled, perhaps you've been at a family reunion, perhaps you've been at other large gatherings over the summer, that will absolutely let us know in that moment in August before you come to campus, were you COVID antigen positive or not?
Yeah.
So it does change, that will flux. That's also why we'll do ongoing testing once you get to campus, so that we can absolutely be sure down the road with some random sampling if we are having an increase in the amount of COVID on our campus. It will change.
Absolutely. Yeah, and I think, one of those interesting pieces, we've had a lot of questions about what is it like to get tested? You're the one who's out there every day instructing those that are going to be doing the testing. Walk us through what it's like to come to our sampling site.
Sure. Well, you will see amazing nursing students out there. They are level 4 nursing students in the traditional BSN program, so they will be graduating in December. These students have a depth of experience and a breadth of experience in infection control, as well as health education at this point. So what's wonderful is that they are taking on the leadership role of providing the education and the expertise to allow a good sampling and an easy process. So if you drive into the testing center, you will get some instruction about what that test would be like. So a student will inform you what you'd like to do. This is a self-administered swab. So the student is not doing it for you, or I'm not doing it for the student or for the faculty. They are doing it themselves, so they get instruction. It is a long swab, long Q-tip, and it goes slowly in each nostril. You want it in the nose for at least 10 to 15 seconds. So sometimes the students will be there counting down with you. To allow you to ensure that you have good sampling. So we want really good contact with the mucosa to get enough cells so that we can have a good sample. So the students are involved in that process. When you drive into the testing center, if you have an appointment, you've probably been given an email, received an email that has a barcode on it. You will have somebody check you in, if you will, so they'll scan that barcode, and you will drive up to our tent. You'll wait until it's your turn to go into the tent. All this time, we ask you to keep your mask on. When you drive up to the bay, a nursing student will ask you with the mask on to roll down your window, turn off your engine. You'll receive instructions on how to do the swab. You will do your own swab with your window up. That keeps the students more protected if you happen to sneeze, and that is not uncommon. And then the swab goes into a special collection tube, and that's it. Drive away. So depending on your appointment time, and if people are coming early, coming late, it could take 5 minutes, it might take 15.
Okay.
But
so,
in general, 5 to 10 minutes will, from start to finish through that process.
wow.
Yeah,
So beginning to
moving.
end, driving up,
Yeah.
all the way through the process, all those steps you just described.
exactly,
And you're out.
exactly.
Yeah, I think
And
that's
somebody's
good
talking you
feedback
through
for
it the
me.
whole time, so you're not lost, you know what to do, you know what to expect. And I think the most important thing is knowing that the nursing students, if you forget, you take your mask off, the nursing students will remind you to put it back on. You forget to roll up your window, they'll remind you to put the window up while you're doing your swab. So
Absolutely.
somebody's there kind of walking you through it.
Very good.
Yeah.
Okay, so we know how long it takes to go through the testing site.
Mm-hmm.
So how long does it typically take for folks to get results?
That is a great question. The answer right now that we are informing students, faculty, and staff about, we're saying 2 to 6 days. Truly, tests are coming back in 2 to 3 mostly. So we are still saying 2 to 6 days. We've noticed a little bit of lag sometimes over the weekend. Sometimes it's been as early as 40 hours. I would say the average is around 2 to 3 days.
Okay. So we know what the sampling site looks like here on
Yes.
campus for the short term before
Yep.
we come back for classes this fall. What is it going to look like when you talked about this ongoing sort of surveillance and sampling that we're going to continue to do?
So I may have to defer to you guys more for that, but we are looking at pooled sampling, so random sampling of individuals throughout the semester, and then those samples will get aggregated or put together. And if that pooled sample tests positive, then you go back to those individual samples. If they're negative, you can move on to the next one. It allows us a way to work through a large volume of people in a random way quite quickly. So that's the plan going forward.
Yeah. And I think it's interesting. You hit on the fact that right now, we're kind of seeing those 48-hour turnaround times once the sample hits the lab.
Yep.
And I think the more literature that I'm reading and the more things that are coming out, and you have your master's in public health, would be very curious to hear your thoughts on sort of the timeline on resulting and why pooled sampling, potentially offers us a way to be able to get results, and why does that matter to get
It's
those results
so much
quickly?
quicker, correct. And so public health is really about prevention and early intervention. Those are the two things we really focus on in public health. So if we can use testing as one arm of a strategy, testing, social distancing, wearing a mask, good hand hygiene, avoiding touching face, right? So there's all these things we need to do together. But if we do those things to prevent the spread of COVID, that's one piece of it. The other piece with this, which is the testing piece, which is so important, we really need to be quick about those results, because if you don't know that you are COVID positive and you are asymptomatic, you are likely not going to change your behavior. But what we know about any infectious health condition, most of my work is in HIV, what we know is if you know you have an infectious disease, you will change your behavior to protect others. So the sooner we can get that information out, the sooner any of us have an opportunity to change our behavior and just be more cognizant of who we're interacting with and how we're interacting. Do we need to self-isolate? Who have we been in contact with? All of those pieces are vital to controlling any sort of COVID spread on campus and being really safe together.
Absolutely.
It's interesting you talk about the change behaviors once somebody knows. One of the interesting things that we assumed coming into this is that we would have a disproportionate number of asymptomatic students, and thus far that seems to be the truth, doesn't
Yes.
it?
Yes.
So those students maybe feel fine, don't know.
Absolutely.
And it kind of maybe punctuates why it is we're doing this testing, right?
It is, and that is absolutely critical moving forward with the random sampling. So being compliant with if being asked to come forward to do another swab. Again, it's self-administered. We're not tickling the brain anymore. So I think that it's pretty easy to do this test. So the compliance with that process is foundational to allowing us to be together on campus throughout the semester. Absolutely.
Yep. And it may be as simple as even spitting in a tube.
If it comes down to that, that will even be better.
Right, yes.
Saliva tests are on the way, and that will make things much, much easier for sure.
Yes, very
For sure.
exciting. So you talked about some of those behavior changes and modifications that we have to make to behaviors. What are some of those things that we can be thinking about right now as we're thinking about coming back to campus? I know you mentioned some of those things, but just kind of reiterating, what are those things that we're stacking hands on to say, if we're coming back together safely, and maybe we're all assuming we're walking around potentially COVID positive, what are some of those things that we're doing to decrease the transmission and keep each other safe?
And what you will see if you if you're a freshman, this will not be unusual to you, but for students who are coming back who have been away for a while, you will notice probably sanitizer in every hallway, almost difficult to not use when you enter a building. So we are encouraging students to keep their hands clean at all times when they enter a building, when they exit a building. We are asking students and faculty to clean Workspace. Just like if you go to the gym, you work out on a piece of equipment, you clean that off when you're done and you move on. We're going to do the same thing in our desk spaces. So if you are in a classroom, even though you will be socially distanced, so maybe it's a classroom that holds 100, maybe there's 30 or 40 of you in that room, you will still be cleaning off your space when you come and when you go, and the faculty will be doing the same. So keeping things really clean, and we will be wearing masks. So that is really important. I think there was a lot of resistance to that initially, but the science is very clear. We certainly know it in nursing from all the years in emergency operations and in special procedures. You always wear a mask if you are trying to prevent infection. It's the same thing here. It's nothing different. So we will be wearing masks, trying to keep those clean, hands clean, social distancing, and we're also having family units in the dorms. So students will be able to be mask free and be closer with people who they're rooming with. And then we will ask for dorm events, certain coming back to school events to occur outdoors, to occur with social distance, and to occur with masks when possible. So all of those things, it's all a strategy. It's not one thing.
Absolutely. Well, we so appreciate you being on the team and all the work you have done, and just really thankful that you have been willing to not only come here today and answer some of our questions, but being a part of the team as we move forward. So
thanks for having me.
I think
Appreciate
that's pretty
it.
great, Dr. Graham.
Thanks.
Thank you.
And we know a lot of you have questions out there too, so we want to make sure that we spend a little time being able to answer any of those.
Yeah, it looks like they're starting to line up a little bit here, so maybe we should jump in here, Dr. Bronson.
Let's do it.
Okay, looks like we've got a question from Sydney. Will students who are fully online be required to take a COVID-19 test? Sydney, the short answer is depends on if you are planning to come to campus. So being online as a student is part of the criteria. So I would say you do not have to test if you are not coming to campus. So that means if you're fully online, but that also means things like, coming on campus for the library and faculty office hours and things like that. So if you are truly at a distance and are not coming to campus, the answer is no. And there's a waiver that you can sign to opt out of that. That's available on our COVID-19 website, or simply email us at safety@coloradomesa.edu. We can get you that waiver if you are going to be fully at a distance all semester.
We have a great question here that I think is good for us to address, and would love your input and thoughts on this. There's a lot of questions around what we just talked about, these modifications in our behaviors that we're going to have to make that makes campus feel maybe a little bit different as we come back for the fall. So one of the questions is about dorm rooms, and what happens if someone wants to bring someone from off campus into their dorm room, because doesn't that increase a little bit of risk?
Yeah. So this fall is going to be different in this regard. You will not be able to bring guests into your residence halls. These residence halls are going to be family units. They're going to be homes. But the only way these family units work is we know who's there, they live there, they come and go, but guests are not going to be able to be allowed in those residence halls. And that's going to be a change for sure. The hope is that we're going to allow enough other spaces outdoors and campus rec and the university center, the library. There's a variety of spaces where you are going to be able to gather with guests and friends and the dining hall and hang out. But your residence halls are going to be sort of sacrosanct for those Mavely units. Mavericks plus family equals Mavely. That's what we're talking about. Those Mavely units are going to be isolated groups, no guests in the residence halls.
And I just wanted to give a shout out, Laura. We saw your comments and just really appreciate that your daughter had a good moving in experience. I
Oh,
think
good.
part of coming back to campus, there's a little bit of hesitation around what is this going to feel like. So
Yeah.
I'm glad to hear that it's been a good experience and that coming back to campus, it is a new normal, but I think you will find people have worked really hard to try and still give you that campus experience that is going to be formative and what we believe is the reason why we are here
Yeah.
trying to do this.
Yeah, absolutely. Glad to hear you had a good experience moving in. Okay, Dr. Bronson, here's a great question. Looks like Garrett's wanting to know what the threshold is for when the university would have to do something extreme like moving back to all online.
Yeah.
How's that going to work? How does public health play a role? Walk us through that.
Yeah, it's a great question. And I think it's one of those pieces as we look at COVID and we have an understanding not only with our baseline testing, we start talking about prevalence. You heard Dr. Graham talk about it. That's the number of tests that we're doing and then percentage of those that are positive from all those testing that we're doing. That gives us a good snapshot of knowing how much COVID we have here on campus. And that's going to be a big piece of what we're utilizing in order to put in mitigation strategies that are going to change. So we're going to be monitoring that as we have our ongoing surveillance testing happening and as people are reporting in their wellness passport how they're feeling. If we're getting a lot of people that aren't feeling well, that's also going to help us trigger mitigation strategies to keep our campus safe. But this is all happening in step with Mesa County Public Health. So they really have, from a county standpoint, have variances that are based on percentages of prevalence in our community. And their threshold, the upper threshold, is 15%. We do know that that sounds like a lot of people, and we do know that those are individuals. This is not just metrics and data. We are understanding that those are people that we're talking about here on our campus. And so it's not that we're going to wait till we get to that 15%. As we see that number rising, 5, 10, I like to think about it as a gradient from everything from a yellow of we're starting to put in different strategies to the orange to the red where we're really looking at, yep, it's time to really shut down campus and go back to being fully online.
Tell us real quickly, the prevalence rate you said, and currently I think it's probably important to point out Mesa County's is in the low to mid 2%.
That's correct.
What is that measuring?
Yeah. So it's really looking at the incidence of how many cases we have positive over how many have tested.
Got it. So
and
the
that's
numerator is positives,
That's correct.
denominator is total tested.
tests.
Got it.
That's exactly right.
Got it. And
Yeah.
we'll do that over a 2-week point in time. Is that right?
That's correct. So we monitored over the last 2 weeks because that really tells us trends. But then we have our full baseline number that we're continuing to monitor from these baseline testing, continuing on to our surveillance testing.
And presumably that rolling average assists us because it also tells us maybe active cases, right? We know that the infection rate is something like a 2-week window. So after that point, a case that was hot 3 weeks ago maybe isn't really a concern to the campus, but the last 2 weeks would be, right?
That's exactly right.
Okay.
That's exactly right.
Well, good question, Garrett. Okay, Shelby's asking about Montrose versus Mesa County and the approach for the campuses. Shelby, it's a good question. We've been in touch with Montrose County Public Health in the same way that we've been chatting with Mesa County Public Health. And as it turns out, the conditions are different, but not dramatically different. And I would use maybe as an example that front range of the Denver metro area. If you look at the cases per 100,000 and overall percent prevalence rates and overall infection rates and things like that, the front range is a wholly different conversation. Whereas the Mesa, Delta, Montrose counties are, and even the western half of Garfield, they really look a lot more similarly. So the other upside that we have in Montrose County is that it's a relatively small campus and not quite so many complications. There's not residence halls, et cetera. So we feel pretty good about the protocols that'll be in place and those protocols that will exist in your classroom and in the study areas and computer labs, et cetera, which will all mirror those here on the main campus.
Yeah, that's right. I think one of the questions that we're going to get are why on campus are some people wearing their masks inside? And particularly, why aren't we wearing ours right now?
Yeah. Well, the governor of Colorado, who gave us direction on these masks, gave us a couple of guidelines with this, right? So anytime we are inside, and all of our friends on the other side of the camera here are masked up, and before the camera turns on, we are masked up, and when this camera turns off, we'll be masked up. Again, but the governor also pointed out that for television appearances and for mass audiences and things like that, for the benefit of things exactly like this, where we can answer questions, that we're allowed to temporarily remove those masks. I would point out that we both tested last week, got our results a few days ago, and are part of the overall campus safety requirements here.
Absolutely. And it certainly highlights the importance of, we all are signing up to do this, and as we continue to lean in, part of that is continuing to wash our hands, wear our masks, all the universal precautions that Dr. Graham talked about. So appreciate your questions, and I think those are important things to address.
Mm-hmm. Looks like we got a question from Callie here about a dorm guest. I think we've already answered the question about no guests, Callie. I'm sorry to disappoint you, but there's not going to be any guests about that. I think you're asking if they take a test and get a negative test, can they come in there? I think the short answer is probably not. We're going to have to hold this pretty firm line that we don't have guests inside the residence halls.
I think the other piece is parents. If your kid has a single dorm room and I'm wanting to come visit, drawing that line with parents as well. And we acknowledge, right, that this is...
Yeah, this is an imposition for sure. It's a little out of the ordinary, but if mom and dad are coming to visit you, I think we're going to ask mom and dad to get a hotel. The Maverick is right here on campus or somewhere else in town, and they can go and hang out and spend time together in your hotel room, but we're not going to be bringing people into those residence halls who don't live there. And I think that's just one of those safety protocols we're going to have to hold the line on in order to make sure that we can stay together all fall safely.
Yep. And as a mother, I get it. You're coming to campus, dropping off your kiddo in a time of a little more uncertainty. And so we understand, we hear that emotion, but also know that that is one of those safety protocols and pieces we're putting in place as we move forward for the fall. So.
Dr. Brunson, we're getting a question about bringing a child home, or they're not children, they're students, bringing your adult student home if they are quarantined. And the short answer is we're going to leave that up to you and your student. So we're going to provide opportunities. If they're an on-campus resident, we will provide both on-campus quarantine beds as well as we've secured a number of off-campus quarantine beds. But if that's not the right arrangement for you or your family, by all means, bring your child or your student home, and if they're better served under the care of mom during that time period, that's absolutely fine. And they're going to, of course, you will want to operate out of an abundance of caution when you return so as to minimize any risks while traveling back. But after you've secured that 2-week quarantine and you're ready to come back, please do so. During that time period, and I think we've talked about this a little bit, how are faculty going to be working with students to ensure that they're not falling behind and so forth when, in this case, let's hypothetically say that the student is asked to quarantine for 2 weeks and they do travel back home to be with mom and dad during that time. What happens in the classroom while they're gone?
Yeah, it's a really great question, and really am so proud of what faculty have done across campus, because it is not an easy lift, and we saw them do that in March and taking what were classes that were all face-to-face and taking them completely online. And faculty have worked really hard over the summer enrolling in online skills courses where they are learning more about the art of being able to take a lot more of this content online. And faculty have stacked hands on saying they're going to do their best to make sure that your education is not interrupted, even when you have to do that isolation quarantine away from campus. And so that may mean joining lectures online via Panopto cameras that we have in all of our classrooms, making sure that we have assignments that are still going to ensure that you're getting the content that you need and the assessments that you need in order to continue with your education.
Yeah. So to summarize, you're welcome to isolate in any of our quarantine spaces, or you can isolate back home with family if that's a better deal. And our faculty are going to work with you during that period of time. We anticipate there are going to be quite a few folks who quarantine. If our early experience is any indication, and I suspect it is, we're going to have students who are feeling fine and they're asymptomatic and have no idea that they're positive. And that's certainly been the case for many of our positives thus far. They're students who wouldn't have known it but for that test. And so it's not that they're quarantined because they're sick. They simply have to isolate until they've passed out of that 2-week window. So we know that'll be, that may be easier to do in the comfort of mom and dad's care. So up to you is the short answer in terms of the quarantine.
Absolutely. We've talked a little bit about what education is going to look like in the classroom. I think there are questions also about how do I continue to collaborate with my fellow classmates, and specifically, can we do group study in the library?
Yeah, the short answer is yes. The library is set up, for those of you that have been in there, that was redesigned just a few years ago, and it really does, it was built and designed specifically for collaboration work. Now, the number of folks collaborating in a given study room will probably need to be reduced in order to make sure that we don't cluster too many folks in there and start getting within those extended 6-foot distance clusters. We clearly don't want that. We want to maintain our safe distances and our safe room occupancy levels. But there's also larger spaces, and the way that the library is built out is specifically to accommodate that. So yes, we learn best in small groups and cohorts and study groups, and that will be absolutely available to masked up, indoors, but in appropriate size groups.
And I think there's also room to talk about how professors are utilizing a lot of technology to facilitate some of those group meetings. So you'll be learning a lot of great tools when you're here on campus of, if there aren't study rooms available, there's other great ways for you to collaborate, even outdoors, maybe even jumping on a Teams meeting. So there are a lot of different tools that we'll have here on campus to help facilitate some of that group learning as well.
Yep, we've learned a lot about how to continue to stay connected during this pandemic.
No doubt, absolutely.
Looks like we got a question about some of the apartment and how we would treat those regarding the traditional dorm rooms. And I think the short answer is our all on-campus residents will be treated the same. And by that I mean apartments, suites, semi-suites, traditional housing, et cetera. We're going to draw the same lines, which is when you're with your Mavily, when you're with your family unit, once that's established, there'll be no guests, there'll be no visitors, and but once you're in those units, you'll be able to operate freely, just as you do at home. But the short answer is that apartments will be under the same guidance and restrictions as the traditional halls.
We see the question on thermal scanners, and I think maybe it's a great time to just open that up a little bit and maybe talk, John, if you're willing to talk just a little bit about not only where they're going to be located, but what's the deal with those, and how often are we expecting folks to utilize those?
Maybe it's helpful to take a half a step back and reflect on what are all the ways that we know we can take safety measures and safety steps, right? We've talked a lot about masks, we've talked about the social distancing, we've talked about, maybe we can talk about Scout a little bit more here in a moment. But one of the things we know about COVID is that fever tends to be associated with those symptoms. It's not a silver bullet. It's not the only thing. It's simply one of them. And so part of what we have attempted to do is make that easy on everybody to find their temperature and take their temperature on a really regular basis. It's a quick and easy thing for all of us to do to stay safe. So we've deployed thermal imaging scanners, which is a fancy way of saying it's an iPad that you simply stand in front of from a few feet away, and it's able to take your temperature quickly and let you know that you're good to go and you move on. We've placed these at each of the residence halls, so as a student is swiping in, checking into their residence hall, they can check their temperature real quickly as they go by the desk. Same is true at the rec center. But prior to going into exercise, they can go in, swipe in, and also take their temperature. Same is true at the dining hall, the library, and others. We'll also have them placed across different kind of rotating basis around academic classroom buildings. Those students who live on campus will be required to do this every day because we know that those students who are living here, eating here, recreating here, et cetera, we want to be extra cautious to ensure we don't have spread among that on-campus group. So you're going to be required to do that once a day. So if you live on campus, you'll get your temperature taken once a day. And you can do that in a variety of locations, but you need to make sure you hit one of those thermal imaging scanners daily. For the rest of us, we've encouraged the campus to use those several times a week, just as a self-care item, right? We want to make sure we're being extra cautious, hit a thermal scanner as you go by. Those operate off of they know your face, so it can, basically you can go in, get your temperature taken, and you don't have to go swipe or do some touching or signing in or anything like that. But it's maintained at that particular unit. And so we're able to quickly and easily make sure that you are safe and well. So that's the idea behind the thermal scanners. It's a lot easier than putting a bunch of thermometers on a string hanging around campus. It's quick, it's a good technology, and it's hypoallergenic what's the right term?
Hypoallergenic.
Hypoallergenic, something like this?
Touchless temperatures.
Touchless, yes.
Yes,
So
yes.
quick and easy.
Yeah, and I think you highlighted a really good point with that, that really the temperature, the ability to be able to check your temperature really is sort of a self-care. And I think it is part of that wellness passport. And maybe this is a good place just to talk a little bit more about Scout and what this wellness passport means and why that's an important piece of us being safe here on campus.
Sure. So I want to maybe start by reiterating. We've talked about it as an app. As a technical matter, it's not an app. It's a web tool. It's a website that you go through on MavZone. So same place you're going to log in to check your grades, to check your bill, to check on your financial aid, to check your email, to access your D2L core shells. There's a little icon there called Scout. And when you click on that, you can, for your own self-monitoring purposes, you can check on your symptoms and see how you're doing. But then we're going to ask you a couple of questions every day, and we're going to ask you to fill it out every day. And that is, have you been in contact with anybody? Have you traveled outside of our area? Right, and so we're going to ask you a series of these questions and ask you to affirm, I'm not feeling any symptoms. And after you've done that, you're going to wind up with a green screen on your phone that just says you're cleared for access for the day. And that's part of all of us being responsible to one another and saying that I'm not having any symptoms, I'm not feeling sick, I haven't been in any high-risk exposure situations, and I'm good to go. So you can expect as a student that faculty and dining hall and residence halls and rec centers and all the various places around campus are going to be asking for this green screen and your wellness passport every day. So you'll need to have that ready. It's just one of those things that all of us are going to have to get in the habit of using every morning. And then it's good up until midnight. And then you'll have to reaffirm the following day. So that app really is just one additional tool for us to tell one another, I'm safe, I have thought about this, I've checked my symptoms, I'm good to go for today.
Absolutely.
Yep.
I think one of the wellness pieces that comes up is we live in a beautiful place, the great outdoors here in Western Colorado, and we got a great question about, hey, can I come visit my student if we are in the outdoors? Yes, please come and visit and enjoy the outdoors, and I think that's one way that not only we do wellness here, but it's a great way to interact with folks here on campus. So yes, the answer is very clear. Come and join us, enjoy the great outdoors. We have a great outdoors program that has a lot of fun toys to come and play with as well.
And you're welcome to come to campus and visit us, right? We're hoping that we're going to bring as much normalcy as possible. Now, while the residence halls aren't allowed to have visitors, as long as you've got a mask and you're participating with all the other protocols on campus, you're welcome to come and see your student and be here on campus. So.
Absolutely. And we do ask that those traveling, that you do look at travel guidelines, CDC guidelines, based on traveling outside of state as we continue to monitor what's happening with COVID, not just here on campus, but within our community. I think that's an important piece as well.
Yeah. One of the questions looks like is about people coming from outside who maybe aren't subject to our testing coming onto campus for events. I think the short answer is it's not totally clear that we're going to have guests at things like sporting events. I know athletics has worked really hard to try and figure out a path forward for sports for fall, but it's not clear to me that we'll have spectators at those sports. So my guess is what will happen is there'll be a lot of streaming events. Maybe even we've been chatting about trying to set up some large screens outdoors and doing kind of drive-in movie style to be able to watch some of these things at a distance and really create some spacing that's useful. So, I think that answers that question.
Absolutely. We also had some good questions around, will students be restricted to just staying on campus and sort of what are the policies and regulations around, hey, I need to go to the grocery store. And,
sure.
Yeah. What can they do? Can we leave campus?
They're free to leave campus. I think what we're asking is that they don't leave the area. And again, by the area, we're defining that as Garfield, Mesa, Delta, Montrose counties. So if you look at the map, it's kind of it's actually a pretty big region, but they're free to do that. And frankly, I would encourage them. This is a mecca for outdoor recreation. Go see the Grand Mesa. Go see the Uncompahgre Plateau, right? Go down to Rabbit Valley. Go ride your bike out there. Beautiful, beautiful places to get outside and recreate. It's part of the reason that we live here is enjoying those outdoors. So absolutely, they're able to go to the grocery store. We just ask that students are continuing, like all of us, to take those precautions, wearing masks and making smart choices.
That's a great question. The other thing that we talked to Dr. Graham about the testing and sampling site that's happening here, and, we're getting some questions about, if I just want to get tested at some point during the semester. We've talked a little bit about the pooled sampling and the surveillance testing and how that's going to work, but maybe just talking a little bit about testing in general, and will that just sort of be open to folks?
Yeah, I think one of the things that we know is that the testing resources are in incredibly tight demand, and they're precious resources. So we want to be really thoughtful about how we use those. In particular, somebody who has an exposure or somebody who maybe was a close contact or the like, and we're going to want to obviously prioritize testing around that sort of thing, right? And as we said, testing is one of those things that we want to be looking at and getting a really good baseline at all times. If a student has a reason why they're concerned, that we certainly want to know about that. And so it would be probably one of those deals where we want to have a conversation to better understand why a student was feeling uncomfortable or was feeling maybe at risk or something like that, to have a conversation to find out if that's appropriate, right?
Absolutely. Yeah, there are good guidelines put out by the CDC. Again, we work with Mesa County Public Health and our partners with St. Mary's and community hospitals. So we really lean in on that health and advisory board and helping us make some of those decisions policy-wise on who gets tested and the reasons behind testing, because we do know that the testing resources are really important during this time.
I jumped past one question that I shouldn't have, and the question is, does Montrose have a thermal imaging scanner? And the answer is we don't have one down there, but we do have these touchless laser thermometers that we've deployed to a variety of facilities, because we only have so many of those thermal imaging cameras, but we've purchased, acquired, and deployed a whole bunch of additional handheld thermal temperature takers, thermometer takers, and those will be available. So we'll have one of those down in Montrose available, and at a variety of additional campus facilities.
Absolutely. I feel like we've spent a lot of our time today talking about a lot of nuts and bolts and COVID-related dialogue, but I look out these windows and I see people outside walking around. Our campus is green. We just want you to know how excited we are to have you here. It's so fun to start seeing some folks back here on campus, and I know my experience today walking across campus is my face is lighting up as I have my big smile back, seeing folks back here and starting to see people populating.
I got to chat with two classes today, some of the early move-ins for the athlete FYI sections, and got to meet some students. We haven't had students here since March, and what a shot in the arm to have students back on campus. It's really great to see them. And for those of you that are planning to come in this weekend or next, we know we've got a series of students coming in. We're thrilled to have you. We realize it's going to be a little bit different, but we are really excited to have you back on campus. Please do abide by all the new safety protocols. But my goodness, we could use some bright spots in the world right now. And I will tell you, watching a bunch of excited 19-year-olds roll onto campus right now is one of them. So we're excited.
That's right. And I know you have more questions, so please feel free. If we didn't get to your question today, please send us an email. Safety@coloradomesa.edu is a great way to get any questions answered. And we know there's going to be more testing questions, more questions about new policies and procedures that are happening here on campus, and we hear you and want to get to those. So please don't hesitate to reach out to us.
All right. So I think we're gonna wind this down and wrap it up. Again, thank you for checking in. If you are watching this after the fact, again, feel free to hit us up on Facebook or Instagram, Twitter, or an email, safety@coloradomesa.edu. So with that, we will say good afternoon. Thanks, guys.
Thank you.